evening, my name is kgorman, and I'm here tonight to share with you some information about the responsibilities of different levels of government in regards to teen pregnancy in the city of Norfolk. First off, why is this important? In 2008, the National Campaign to Prevent Teen and Unplanned Pregnancies reported that teen childbearing in Virginia cost taxpayers at least $215 million. That breaks down to 35% being federal cost and 65% being state and local cost. Nationally, the cost to taxpayers was $20.9 billion for teen childbirth. According to the Virginia Health Department, out of every 1,000 females between the ages of 10 and 19, there were 46.7 births in 2008 and 47.8 in 2009 in the city of Norfolk. That average is higher than most areas within the state. Because of this high rate of teen pregnancy, the state government has appointed Norfolk as one of 7 cities to be part of the Teen Pregnancy Prevention Initiative. So let me break down the levels of responsibility in the government. On a local level, the city of Norfolk has established the Teen Pregnancy Prevention Program. The Norfolk Teen Pregnancy Prevention Program, commonly known as the Real Alternatives to Pregnancy, or RAP, is a comprehensive, community-based program designed for preteens, teens, parents, and the Norfolk community at large. RAP offers a network-enhancing activities and general community education activities, an annual conference, and an intensive intervention program in middle schools, high schools, and community centers throughout the city. They also have a nurse practitioner who is available to promote teen pregnancy prevention methods. They have enhanced outreach focus and provides clinic services to teens in their family practice, Family Planning Clinic. What is the state role? Virginia works to deliver access and availability to multiple different levels of care. Just to name a few: family planning services, children's access to primary care providers, mental health and chemical dependency providers, adolescent well-care visits, pediatric mental health services, checkups after delivery. The state's efforts are based on the core idea that preventing teen pregnancy should be approached not only as a reproductive health issue, but one that incorporates all the social ramifications involved. If more children in Virginia were born to parents who were ready and able to care for them, we would see a significant reduction in a host of social problems, from school failure and crime to child abuse and neglect. On the national level, there is federal funding given to each state to help fund programs that work towards prevention and education. It is even part of the presidential's health care reform. In 2010, the State of Virginia Health Department won a grant for $1,500,000. It will be used to focus on pregnant women who are at institutions of higher education, victims of domestic violence and sexual assault prevention services, and public awareness and education. And lastly, on the home front, this issue isn't just a problem of state or national government. Responsibility also lies with the parents of these young people. As a parent, it is important that we are communicating with our children. We also need to be aware of some key conditions that put our young women at risk. The following risk factors were compiled by the Virginia Health Department: use of alcohol and or other drugs, including tobacco products, drop out of school, lack of a support group or have few friends, lack involvement in school, family, or community activities, perceive little or no opportunity for success, live in a community or attend a school where early childbirthing is common and is viewed as a norm rather than as a cause of concern, grow up under impoverished conditions, have been victims of sexual abuse or assault, have a mother who was age 19 or younger when she first gave birth, began dating early, dating at the age of 12 is associated with 91% chance of being sexually involved before the age of 19. And dating at the age of 13 is associated with 56% probability of sexual involvement during adolescence. If any of the above are influences that you know they are exposed to, then it is important that they are given help. If this is not an area that you as a parent are comfortable with, then at least as a parent, we must know where they can go to get the information. We have to be involved in our children's lives. In closing, teen pregnancy does not only impact the teen, it puts a burden on many areas from social to financial and makes the future of a young woman and mother more challenging. So we must combine our efforts and work towards prevention. It's not just the young lady's fault. Remember, it takes two.